Hey, thank you everybody for being here today. So I'm going to talk to you about the evaluation that was done of the Project 360 intervention, which some of you may be familiar with, some of you less so. So I'm going to talk for about 30 to 40 minutes, and then I'm happy to open up the floor to any questions that you might have about the evaluation itself. So this project was done with Martin Koppensteiner, who you've already met, and Reka Plugor, who I believe is in the audience somewhere. We've been working on this for about two and a half years with Leicestershire Police. So it's been a long, ongoing project. And like Martin said, there was a lot of excitement, which has carried through up until now, I would say. So one of the things I found really shocking when we first started this project was when I saw the actual numbers of police reports for domestic violence. So Leicestershire Police respond to about 17,000 calls for domestic incidents every year. This seems shockingly high. So I thought Leicester was disproportionate with the rest of the UK, but as it turns out, if you look at that on a per capita basis, so it's about 17 reports per 1,000 people, it's actually in line with the rest of the UK. So this is a similar rate for the rest of the UK. So this is a widespread problem. Now, about more than 7 calls every single day involve a victim with whose this is not their first case of domestic violence. So this is a real prevalent problem in society. Now, domestic violence is a really complex issue. I'm sure everybody in this room is aware of that. And effective victim support is probably going to require some sort of specialist knowledge. Accessing the supports that are out there, so supports other than police services, this can be a daunting process and it can be confusing for victims. So there are a lot of possible support services that can be accessed through most counties. Now, these support services almost always rely on the victims initiating contact. On top of that, they rely on victims providing background information for the services. Okay. So really, at the heart of it, what Project 360 is trying to do is to mediate that transition from police to support services in the community. Okay. So engagement workers who are employed within the police provide a secondary response to victims after police have already been to respond to a domestic incident. Okay. Now, following a reported incident, what happens is the domestic workers engage with the victim within 24 hours. So it's very rapid telephone engagement. They inform the victims of any services and options that are available to them. These might be police services, they might be local services. So they make sure the victim is aware of the range of possible options that they have. And then finally, they help the victims create a bespoke action plan. Okay, so they put them in touch with the services they may need. They provide referrals, and if necessary, in many of these cases, there's a face-to-face visit where they actually sit down and work with the victim. Okay. So a key to Project 360 working is the embedding of these engagement workers within the police force. This gives the engagement workers access to police information. And it's this police information that allows them to make active contact with the victim because they see reports as they come in. They can collect essential background information before making contact with a victim so that they can help tailor a plan for them. And they can safely meet with victims because they know any dangers that may be lying. And they also have very easy contact with police services. Okay. So we actually have a couple of the Project 360 engagement workers in the room with us. If anybody wants to, you want to just raise your hands? If anybody wants to have a word with them about their experience, they've said they'd be happy to do so. I'm sorry, oh, could you just raise your hand? Yeah, these two ladies right here. Okay, so in interviews we did with the engagement workers, one of them summed up this access to information really nicely by saying, in previous domestic abuse work, I was trying to do my job completely blind relative to the information they now have. Okay. So now our job as researchers is to try to quantify the effects of Project 360. And we're going to look at a number of different areas. So we have a victim survey where we're going to try to look at victim-reported welfare and satisfaction with their policing experience, the provision of statements to police by the victims, and then, of course, repeat police call-outs, and we're going to look at that up to 1 year following the intervention. Okay, so just so you know where we're going with all this, first I'm going to provide you with a little bit of background information. Then I'm going to go through the results for each of those areas really quickly, and then just summarize and give some potential recommendations. Now, I should just tell you, I'm not going to go over every single result that we found. So there is going to be a policy report, which we'll make sure everybody in this room receives after the conference. And there's much more detail in that report. In the interest of time, though, we'll stick to the main results. So we worked with IT services at Leicestershire Police to develop an automated workbook. So what we wanted to do was run a randomized control trial so we could really tease out the effectiveness of this program. So we needed some sort of a system to allocate cases across a treatment and a control group. So it should be pointed out that both the treatment and the control group will receive normal police services. So we're not changing the services that receive normally. What we're doing is the treatment group will be the group who receives the intervention, the Project 360 intervention. So what happens is officers will respond to a domestic incident, and following that domestic incident, they file a report. Once that report is filed, the automated workbook assesses the report on 3 criteria. So one is we're only going after cases which have had between 2 and 7 previous instances in the past year. So these are repeat cases that we're interested in. Okay? And I should say that's where the victim has been involved in 3 to 7. Second, we're only looking at standard and medium risk cases. So high risk cases will be outside of the Project 360 intervention. So the majority of these cases are in fact the standard and medium risk. And they have not received the Project 360 intervention previously. So this will be taking place over a 6-month period, so it's quite possible that a victim will show up multiple times in police incidents over that period. We're only going to be looking at 1 intervention per victim. Okay, so those who meet the criteria are added into our subject pool, and then that subject pool is divided 50% into the treatment group and 50% into the control group. So for those who are in the control group, their case and victim safe contact information will be passed on to an engagement worker. Okay? So the engagement worker doesn't see information from the control group. Okay. So as I said, this ran over a 6-month period between November 2014 and April 2015. This ended up with just over 1,000 cases in the subject pool. So roughly a 50-50 split between the treatment and control group for that. So this makes this the largest randomized control trial ever run for this type of intervention. Okay, so for those of you who aren't completely sure where you are right now, so Leicestershire Police Force area is located in the East Midlands, and they service a population of about 1 million people. Okay? So a third of that population is located in the city of Leicester, with the remainder spread over 300 towns and villages. Now there are 3 local authorities that capture this area. So we have Leicester City, Leicestershire County, and Rutland County. But it's all policed by, of course, the Leicestershire Police Force. So what we did here is we just mapped out the number of cases per 10,000 people across the county. So what we end up seeing here, so the dark red areas show you the higher domestic incident places, whereas the lighter going towards white areas mean we have lower instances of domestic violence. So remember, this is pretty close to this maps pretty much all of the repeat incidents over that 6-month period. So this is really telling us something about the problem, at least as far as repeat instances go across the county. And what we see here is the more affluent southern areas tend to have less domestic violence. That said, nobody is free of this problem at all. So we do see domestic violence everywhere. Now we can drill in, something else I just wanted to point out is that if we look at Leicester City, it takes a disproportionate share of the domestic violence. So comparing Leicester to the next highest district in the county, it's almost twice as high. Okay. Now we can drill in on Leicester City, and there's some interesting stories which I'm not going to go too much into here, but something that we do see is this income or affluence gradient with domestic violence as well. So if we compare the Knighton area, which is where we are right now, to New Parks, so we see a 7-fold increase in domestic violence, in reported domestic violence rates. Now this is comparing Knighton being one of the most affluent parts of Leicester and New Parks being one of the poorest parts of Leicester. Okay, so here's some characteristics that we see from our sample that are quite interesting. So, not surprisingly, the vast majority of these cases involve a female victim. So 87% of all cases are female victims. The number of female perpetrators is far smaller. So 14% of all cases involve a female perpetrator. Okay. Employment rates are very low among these households. So we see about 48% employment for the victims and 52% employment for the perpetrators. Victims and perpetrators cohabitating is just over half of this sample. So 56% of all victims and perpetrators are currently living together when the incident happens. And 75% of all victims and perpetrators would be in what's described as an intimate relationship. Of these households, 58% of them have children involved. Okay? So a pretty staggering amount of children are exposed to repeat instances of domestic violence in Leicester. Now on average, so I said these are repeat victims, and we look at, well, on average, how many times do we see these victims showing up in domestic instances? And the answer is 11.2 previous instances before they get to the point of the Project 360 subject pool. Okay, so this pie chart just breaks down the level of engagement among the treatment group only. So this is only people who are allocated into the treatment group. So there's 3 types here. So we see people who were contacted and engaged at 51%. People who were contacted without engagement is 29%. And then 20% of victims were just unable to be contacted. Now, if we don't consider the victims who were unable to be contacted, that means of the people who were contacted, 71% engaged with the intervention. So that's a really high number if you think these are victims who are cold called by an engagement worker the day following an incident. So this resulted in 128 face-to-face meetings and 133 phone assistance provided by those who engaged, or for those who engaged. Okay, so I'm going to start going over some of the main results here, and we're going to start with the 1-month victim survey that was conducted. So this survey was delivered 1 month following the intervention by telephone, and it was administered by Leicestershire Police Information Services. So we worked with them to design an appropriate survey which tried to get at some of the things we were interested in, but we had experts delivering this. So we ended up with 214 completed surveys altogether, and we tried to group questions into 3 different categories. So we're going to look at changes in victims' perceived safety and well-being levels, actions that were taken by the victims, and victim satisfaction and engagement with police services. Okay, so here's the first set of questions that tries to get at well-being and safety. So this set of questions are all designed in the following way. So since making this report, my family life or quality of life overall has improved, stayed the same, or gotten worse, with everything referring to just before the initial incident. And what we see here, so the way you want to read this is this bar right here is telling me that in the control group, 44% of victims said that their family life had improved since the initial incident, and 20% said that their family life had worsened since the initial incident. So we want things to be going in that direction. Same with quality of life here. Okay? So this is for the control group, and we want to compare that to the treatment group. So here's for the treatment group. So we see a general movement in the right direction. So a significant drop in the number of victims who say their family life has worsened since the intervention, and a small increase in the number who say their family life has improved. If we look at quality of life overall, this has improved considerably for victims who received the intervention. Okay, so overall, we say that this is going in the right direction. This is what we want to see. Now, another thing we looked at was stress levels. And we looked at, so what I'm going to show you is just for the general question of stress levels, but we looked at other things too, like self-reported mental health, sleeping habits, things like that. And everything is going to tell the same story that I'm going to show you here. Okay? So if we look at stress levels for the control group, so 50% say their stress levels have improved since the initial incident, 19% say they have worsened. Now here's for the treatment group. So we see a big drop in the number of victims in the treatment group who say their stress levels have improved. So this implies relative to the control group, we see a worsening of stress levels. Now, if you take all of this together with the quality of life measures, this was an unexpected result, but there's actually a pretty reasonable explanation for why you would see this. So if victims in the treatment group are actually more likely to be taking actions to change their situation in some way, that's a stressful thing to go through. It would be shocking if we didn't see a drop in stress levels, okay? Or a worsening of stress levels. So this points towards something was happening. Okay, now, so that brings us to actions taken following the incident, okay? So we looked at a number of actions taken. So here we're showing whether you're currently in contact with the perpetrator, visited a GP as a result, or A&E as a result of the incident, whether you feel confident in accessing services, so these are local services that are available, and then of course whether you've accessed one or more of those services since the initial incident. So just focusing on currently in contact with the perpetrator for a second, so 58% of the control group is currently in contact with the perpetrator. Now this is roughly how much of the control group was living with the perpetrator at the time of the initial incident. So it doesn't appear to be a lot of change in the control group. Now looking at the treatment group. So we see a big decline in the number of victims in the treatment group relative to the control group who say that they are currently in contact with the perpetrator. They're also significantly more likely to have visited a GP, and although we don't see any change in confidence of accessing services, whether they do access a service or not has increased. Okay? So these first two results are particularly notable. So this implies we see a 34% decrease in the number of victims who are currently or in contact with the perpetrator, and a 41% increase in victims seeing their GP because of the incident. Okay? So, and finally, satisfaction with police handling of the case. Okay? So this graph shows, so we asked victims, are you satisfied, dissatisfied, neither satisfied or dissatisfied with police handling of your case? And in the control group, we see 73% of victims report being satisfied with police handling of the case. So that's actually a pretty high number. But there's still this big 21% who are dissatisfied with police handling of the case. Once we look at the treatment group, we see a very significant 43% decrease in the number of victims who report being dissatisfied with police handling of their case. Okay. And then finally, so this might be one of the things we really care about, is what has happened to your likelihood of reporting a future incident. So obviously, if domestic incidents are happening, we want those to be reported. Okay? So we asked whether the likelihood of reporting a future incident has increased, decreased, or stayed the same. What we see for the control group, so we see 36% increase, but 15% decreased relative to before the incident. Looking at the treatment group, we see a 39% increase in the number of victims who say their likelihood of reporting a future incident has increased. So these are things, these two results are really pointing towards an improvement in the relationship between victims and the police services. Okay, so now we want to look at victim statement provision. Now, of course, we might really care about victim statement provision because this is really a first step on the road to utilizing police services in an effective way. Okay? So if we look at these two pie diagrams, so this shows the distribution of arrests and other actions by police with no victim statement, and this is actions with a victim statement. So in the case of no victim statement, 90% of all cases result in no further action being taken by police. Once a statement is made, arrest rates jump up to 58%. Okay? Now, we can't infer some sort of direct causality, so it might not be the statements causing the arrests. It could be that if a perpetrator is arrested, victims are more likely to make statements. But this does imply that statements play an important role in this whole process. Okay, so now I'm going to show you our three main results as far as statements are concerned. And you really have to digest all three of these results to get the big picture of what's going on. So this really highlights some of the complexity in really trying to quantify the effectiveness of these programs. So we see a decrease in the number of statements that are made to police. Okay? So this is actually a pretty significant decrease. It works out to be about a 20% drop in statements, 25% drop. So fewer victim statements in the treatment group. We also see fewer statements being retracted in the treatment group. Okay. And then finally, of those who made a statement, the treatment group statements are more likely to result in an arrest, okay, or are more likely to have an arrest associated with them, I should say. Okay. And this is actually a pretty sizable change. So let's think about this, because this was a very puzzling result for us at first, because part of the whole objective of Project 360 was to make it easier for victims to make statements. That was one of the goals. But what we have to keep in mind is, as well as statements, it's making it easier for victims to access a whole range of services. This means that some victims may find themselves better served not by making statements, which without the Project 360 engagement worker, they may have seen as their only option, but instead going to some other services, perhaps services that are external to the police. Okay? So statement making is an effective way of utilizing the police services, but utilizing the police services may not be the best option for every single victim. So what we end up seeing is a more effective use of statements as a form of police services because it's easier to access these other services. Okay, and now future incidents. So this is the bane of every study which tries to evaluate the effectiveness of one of these secondary responder programs. And the reason is you have two possible effects going on, if there's any effect. So one effect is that, well, the intervention actually led to a decrease in domestic violence in the household, which is going to put downward pressure on repeated future incidents. There's just less violence, and that's a really good thing. Another effect is that, well, it's led to more engagement with the police. So victims are more willing to report instances. So we would expect to see this put upward pressure on the number of instances that are reported in the future. Okay? So here's what we find. So this plot here just shows the proportion of victims who had a repeat incident in the first 3 months, in the next 3 months, and then for the rest of the year. And what we see here, so there is a slight difference. So the solid line shows you rates for the treatment group. The broken line shows you rates for the control group. There is a slight difference. So it appears the treatment group is a little bit more likely. These are not significant differences, though. So I wouldn't be willing to hang my hat on these two lines being different from one another. Okay? Now, what is noteworthy is 61% of all of the victims end up reporting another domestic incident within the year. I guess that's not shocking considering the makeup of the subject pool to begin with. Okay? So we tried to disentangle, well, maybe the victims are just more likely to report instances. So if that's the case, we might expect to see less severe instances on average being reported in the treatment group than the control group. So we looked at things like the DASH assessment for each instance, which has, I believe, 24 different risk factors that could go into the victim's case. And so we do find the treatment group has slightly lower number of risk factors identified. Again, this is not a significant result. We also look at arrests. So the probability an arrest was made for each one of these cases. And again, we find that the treatment group has a slightly lower arrest rate. So if you were really to take liberties, you could interpret this as they're more willing to report. But it's a little bit difficult to draw any firm conclusions from this. So what we do find that's significant, though, is when we look at instances that are not domestic instances. So you wouldn't expect the Project 360 intervention to lead to any change in non-domestic instance reporting unless it were through how the victims feel about their engagement with the police. And here's what we find. So this is non-domestic instances. And this difference is significant. So that's almost a doubling in the number of non-domestic instances for the treatment group relative to the control group. And we looked at where this is arising from, and this can really be attributed to instances that are reported as theft or damages within the first 3 months in particular. Okay? If we look at reporting of assault, which may be considered a more serious crime or a more severe crime, we don't see any difference. So this is giving us some evidence that there does appear to be a change in victim attitudes towards their engagement with police. Okay, so those are the main results. I'm just going to finish with a little summary and some recommendations that come out of this report. Okay, so here's what we find. So we find a high engagement rate among victims who are contacted. So this suggests that there is a demand for this service out there. We find a positive impact on police-victim relationships. In particular, police satisfaction increase, willingness to report increase, and importantly, contact with perpetrators seems to be decreasing. Okay? Really important result is we see more effective use of police statements. Okay? So once a statement has been made, that's when that becomes costly in terms of police resources. So statements that lead to a conviction, lead to an arrest, are the statements that we really want to make sure happen. Okay? We do see very little change in future reported domestic incidents. There's some evidence to suggest that there's an increase in reporting rather than an increase in violence or anything else. But again, these are relatively weak results. Okay. So recommendations that we have. So these aren't all the recommendations that are in the final report, but these are the main ones that I'd like to push out there. Okay. So first of all, we feel very optimistic about this program based on our results. You have to remember, this is actually just a trial that was run. There's still things that can be perfected about it. And the results we received really point to some positive outcomes. So we're recommending that secondary responder programs modeled around Project 360 be rolled out more widely as standard practice in UK police forces. The intervention should really be provided at every incident. So remember, what we're looking at is a victim receiving one intervention. Okay? So we don't see any repeated reinforcement of this relationship between the engagement worker and the victims. So given that we find some nice results, imagine what could happen with a repeated interaction. And then finally, what I haven't really talked about at all is households where children are involved. And in these households, more focus should be placed on future implementations into working with schools. Okay? So I think Project 360 has a real opportunity here to focus more on working with schools in these interventions. Okay? So as part of this project, we also did some interviews with designated senior persons across a number of schools in Leicester, and 3 service gaps as far as not just working with police, but with public services in general were identified by the schools. Every single school referred to these 3. The first is they lack information that helps them identify pupils from households which have experienced a recent incident. Without that information, there's not much they can do to try to intervene. The second is consistency and follow-up information on the status of pupils who have been affected by domestic violence. And third, they feel they lack a contact person who they can always go to for consistent information and to report any incidents they might be concerned about. So the engagement workers are really uniquely positioned to address some of these service gaps. Okay, so some final thoughts. So the Project 360 improves the transition for victims from police services into other forms of support services. Okay. The intervention, really, it's relatively simple. It involves hiring and setting up desk space for your engagement workers and, of course, training them. But other than that, it's not a major overhaul of any services that currently exist. Okay. And finally, I just want to note that Project 360 I'm not in any way implying that this is a replacement for existing services that are out there. So something we have to remember is this intervention is really only available for victims who have reported a domestic incident. So existing services still play a really important role in victims who have not reported their domestic incidents. So this is not in any way a replacement. Okay. Thank you very much, and I'm happy to take any questions that you might have.